Hello everyone, and let's start. The aorta is the main artery that carries the blood away from your heart to the rest of your body. The blood leaves the heart through the aortic valve. Just as the blood crosses the valve on either side of the outer side of the valve opening, the openings of coronary arteries are present. Their openings are controlled by aortic valves. One aortic valve opens, the entry of coronary arteries closes, which opens after the aortic valve closes. The blood then travels through the aorta, making a cane-shaped curve that allows the major arteries to deliver oxygen-rich blood to the brain, muscles, and other cells. It is to be noted that endothelial lining of aorta is continuous with endocardium, and the aorta is a cane-shaped artery, which means it starts in the left side of chamber of your heart, which is the left ventricle. From there it extends up towards your head a short distance before curving down. The aorta passes through your chest and abdominal cavities and ends at your pelvis. It is to be noted that aorta can be divided into three major parts, that is the ascending aorta, aortic arch, and then descending aorta, and further to be told that each of these three parts of aorta are associated with major anatomical landmarks with each of their surroundings. The aorta is the largest blood vessel in your body. It is more than 1 foot long and an inch in diameter at its widest point. As the aorta makes its way towards your pelvis, its diameter narrows to 2 centimeters. It is to be further elaborated that aorta carries highest pressure of blood, and pulsation of gushes of blood on each heartbeat can be felt on auscultation and palpation where the branches of the aorta are closer to the skin. A complex aorta is made of a complex structure that has three layers of tissue. These include the inner layer or tunica intima. This is the inner layer tube through which the blood passes. It contains smooth muscle tissue, connective tissue, and endothelial cells. These special cells enable blood to transport oxygen and nutrients without getting absorbed until it reaches the right spot. Middle layer or tunica media. This layer is made of smooth muscle tissue and elastin and collagen, which are proteins. It is at this point that elastin and connective tissue are highest in capacity or higher in numbers. These substances enable aorta to meet your body's changing blood flow needs. The aorta is the main vessel through which oxygen-rich blood travels from the heart to the rest of the body. It also delivers nutrients and hormones. Aorta branches ensure that substances reach your internal organs and nearby supporting tissue through these branches. The aorta is the primary source of oxygen and essential nutrients for many organs. If disease or injury affects blood flow through this vessel, life-threatening complications can occur in minutes. The aorta has many sections, including the aortic root, which is the section that attaches the heart. This is the widest part of the aorta. The aortic root is a complex structure that contains the aortic valve and the origins of left and right coronary arteries. Normal function of aortic valve can be altered by changes in the size and shape of the aortic root. And other way, the aortic valve, which is the three flaps of tissue leaflets that snap open and shut to release oxygen-rich blood from the heart. In pathological aspects, it could be a bicuspid valve which needs surgical intervention to correct. Now, ascending aorta is an upward curve that occurs after the aorta leaves the heart. The ascending aorta is the first part of the aorta, which is the largest blood vessel of your body. It comes out of your heart and pumps blood through the aortic arch into the descending aorta. The aorta plays a major role as the main pipe supplying the blood to your entire body. Aortic arch is a curved segment that gives aorta its cane-shaped look. It bridges ascending and descending aorta. The aortic arch is the top part of the main artery carrying blood away from the heart. Here it is to be mentioned that aortic arch syndrome refers to a group of signs and symptoms associated with the structural problems in the arteries or that branch of the aortic arch. Now the descending aorta is a long straight segment that runs from your chest or can be called as thoracic aorta to your abdominal area or known as abdominal aorta. Here the descending aorta is the longest part of the aorta, which is the main arterial blood vessel in your body. It carries oxygen rich blood from your heart throughout your chest and diaphragm. It branches off in smaller arteries in many places to supply blood to parts of your upper body. Well, there are many branches of aorta and many smaller branches branch off from the aorta, including ascending aortic branch have coronary arteries that supply blood to muscle tissues in your heart. Aortic arch branches have brachiocephalic trunk, which branches into right subclavian artery that supplies the right arm, and the right carotid artery that supplies the brain and right side of head and neck. Left subclavian artery supplies your left arm and back of your brain, while left carotid artery supplies your brain and left side of the head and neck. Descending thoracic aortic branches are bronchial arteries that supply the bronchioles structures deep within the lungs. Mediastinal arteries supply the mediastinum, a space between the lungs that houses the windpipe and esophagus, and more so, esophageal arteries supply esophagus, a tube that connects the throat to the top of the stomach. Pericardial arteries supply the pericardium, a protective sac that lubricates the heart. Superior phrenic arteries supply the thoracic vertebrae, spinal cord, and muscles, joints, and skins of the middle back. Descending abdominal aortic branches that provide celiac trunk arteries supplying organs of your gastrointestinal system, including stomach, liver, spleen, and pancreas. Superior and inferior mesenteric arteries supply your intestines. Renal arteries supply your kidneys. Gonadal arteries supply ovaries in the woman and testes in the men. Lumbar arteries supply the lumbar vertebrae and spinal cord, while it also supplies muscles, joints, and skin of your lower back. Middle sacral arteries supply the lower part of your spine, which is the tailbone and the top of your pelvis. Iliac arteries supply the lower extremities. Now, there are conditions that can affect aorta or diseases and defects or injuries that can affect aorta's ability to do its job. These conditions include aortic regurgitation or leaky heart valve. The aortic valve leaflets in this case do not snap shut at all the way. This causes the blood to flow back into the heart instead of your body. While other defect is aortic stenosis. This is the aortic valve which becomes stiff and narrow, limiting the blood flow to your body. Bicuspid aortic valve disease is also a genetic problem where aortic valve has only 2 leaflets instead of 3. This defect is present at birth, but might be there might be another cases like aneurysms, dissection, ruptures. Some of the more common issues affecting aorta include abdominal aortic aneurysm, a weak bulging spot in the aorta that occurs as it passes through the abdominal region. An abdominal aortic aneurysm is a bulge swelling in the aorta, the main blood vessel that runs from the heart down through the chest and the tummy. An abdominal aortic aneurysm can be dangerous if it is not spotted early on. It can get bigger over time and could burst or rupture, causing life-threatening bleeding. Dilated aortic root is an abnormal widening of the root of the aorta, otherwise known as aortic root aneurysm. A dilated aortic root is when the first section of aorta where the aortic valves reside and becomes enlarged. When the enlargement reaches a critical size, there is a risk of it rupturing or tearing or leading to a life-threatening situation. An aortic valve and root replacement, composite aortic root replacement can be said as well. The surgeon removes a section of a body's largest blood vessel or aorta which has aortic valve. The section of your aorta is replaced with an artificial tube or graft, and your aortic valve is replaced with a mechanical or biological valve. Thoracic aortic aneurysm is a bulge in the aorta that occurs as it passes through the chest. A thoracic aortic aneurysm is a weakened area in the body's main artery in the chest. When the aortic wall is weak, the artery may widen. When the vessel is significantly widened, it is called an aneurysm. A thoracic aortic aneurysm is also called thoracic aortic aneurysm, and This aneurysm is a serious health risk because depending on its location and size, it may rupture and dissect or tear, causing life-threatening internal bleeding. When detected in time, a thoracic aortic aneurysm can be repaired with surgery or less invasive techniques. And further to be said that thoracic aortic aneurysm are rare, which occur in thoracic area, occurring approximately 6 to 10 per every 1 lakh people. About 20% of the cases are linked to family history. Your risk is higher if you have certain genetic syndromes as you age. If you smoke, if you have high blood pressure, these things can increase in symptoms. While the symptoms of thoracic aortic aneurysm may include pain in the jaw, neck, and upper back, pain in chest or back, wheezing, coughing, shortness of breath as a result of pressure on trachea or windpipe, hoarseness as a result of pressure on the vocal cords, and they can be trouble swallowing due to pressure on the esophagus. Penetrating aortic ulcers are fatty buildups or plaques that break down the tissue of the aorta's inner layer to reach the middle layer. This irregularity of the aortic wall or ruptured aorta is a tear that extends through all the layers of the aortic wall tissue. This causes oxygen-rich blood to spill out in the body. The most common characteristic aortic dissection is its abrupt start. It can happen at any time, while doing anything or at rest or when you're sleeping. Common signs and symptoms include sudden severe sharp pain in your chest and upper back, also described as tearing, stabbing, or ripping feeling. Some congenital heart defects affect the aorta, which include the coarctation of aorta, where aorta is abnormally narrow. This makes the heart to work harder than it should do to pump blood out of the body. Aortic coarctation is a narrowing of the aorta. It forces the heart to pump harder to move blood through the aorta or its lumen. Coarctation of aorta is generally present at birth. It's a congenital defect, and symptoms can range from mild to severe. The condition might not be detected until adulthood. Now, hypoplastic left heart syndrome is also a genetic syndrome and is a birth defect that affects normal blood flow through the heart. As the baby develops during pregnancy, the left side of the heart does not form correctly. Hypoplastic left heart syndrome is one type of congenital heart defect, and most infants die within first 2 weeks of life, with an average age at death is about 4.5 days. Some patients with hypoplastic left heart syndrome, however, can survive beyond 60 days without any surgical intervention through the development of pulmonary hypertension. Hypoplastic left heart syndrome can be detected on prenatal sonography between 18 and 22 weeks of gestation with the 4-chamber view of fetal heart. Hypoplastic left heart syndrome carries a poor prognosis with survival rate of reported to be 40 to 55% after prenatal diagnosis. Interrupted aortic arch is a rare condition in which aorta doesn't develop correctly. It affects the blood of the body and requires treatment shortly after birth. An interrupted aortic arch is a rare heart condition that happens when aorta doesn't form completely. The aorta is a heart's main pipeline carrying oxygen-rich blood to the body. Normally, it is shaped like an arch or curve. In an interrupted aortic arch, a part of aorta is missing or leaving a gap. This defect is usually associated with large ventricular septal defect. Patients with interrupted aortic arch, particularly with type B, often have a genetic disorder called DeGeorge syndrome. Patent ductus arteriosus is an opening between aorta and pulmonary artery that does not close on its own after birth. This causes oxygen-rich blood to flow to the lungs and other types of the aortic disease. Patent ductus arteriosus is an extra blood vessel found in the babies before birth, just after birth. In most babies, we have an otherwise normal heart, and patent ductus arteriosus will shrink and close on its own in the first few days of life. If it stays open longer, it may cause extra blood to flow to the lungs. After birth, the ductus arteriosus normally closes within 2 or 3 days. In premature infants, the opening often takes longer to close. If connection remains open, it is referred to as patent ductus arteriosus. The abnormal opening causes too much blood to flow to the body's lungs and heart, and Additional aortic conditions are like aortic atherosclerosis, where plaques that develop inside the wall of aorta, or aortic infection. It is a rare condition that occurs when aorta becomes infected, or aortitis. It is the inflammation of the walls of aorta. This rare condition is more likely to develop in people with autoimmune diseases and attack healthy tissue. Aortic trauma is also a phenomenon where severe injuries can happen, that like tear or damage to the aorta. These injuries may be due to falling from great heights, high-speed collisions, or being ejected from a car. Mural thrombus is a blood clot that affects the blood flow through the large vessels such as aorta. Takayasu arteritis is the inflammation affecting the branches of the aorta that deliver blood to the arm, neck, and brain. It is aortic disease. Can be genetic. Yes, it can. They can be genetic. Certain aortic diseases include aneurysms. Dissections can run in families. Genetic conditions, especially ones affecting the connecting tissue, can also lead to aortic disease. These include autosomal dominant polycystic kidney disease, DeGord syndrome, Ehlers-Danlos syndrome, Loeys-Dietz syndrome, Marfan syndrome, Turner syndrome, and Williams syndrome. And this is all about aorta, just an overview to get an idea of what it is. Thank you. Do like and subscribe if you like it. Thanks a lot.